I'm Dr. Neneman with Neneman Chiropractic Clinic, and welcome to today's video blog. I always enjoy when I have viewers or patients email me with a potential video blog topic. A few weeks back I had a patient email me about Bell's palsy, so that's what I'm going to talk about in today's video blog. She basically had three questions. One, what is Bell's palsy? Two, how can stress relate to Bell's palsy? And then three, she's heard that chiropractic has had positive outcomes on people with Bell's palsy, and so how is that? She had actually had a family member that basically came down with Bell's palsy after a bout of stress, and so that's what kind of prompted her to email me these questions. So I'm going to go over those three questions here in this video blog. So the first question is, what is Bell's palsy? The face is innervated by cranial nerve 7, called the facial nerve. It's one of the many cranial nerves, or nerves in the head. And basically, what can happen is if that cranial nerve 7, that nerve runs and innervates the face. If there's inflammation on that nerve, it can actually cause a temporary paralysis, which causes the face to droop on that side. And so that's what Bell's palsy is you'll actually see a person's face drooping on one side. And again, that's usually due to inflammation on that facial nerve. So her second question was, is it, her family member's Bell's palsy seemed to come on with stress, so how is that related? Well, typically, there's several different thoughts out there on what actually causes Bell's palsy. One of the common things is that the herpes simplex 1 virus, that's known as the cold sore virus. A lot of people get that. Obviously they don't always have cold sores. The virus can be dormant in the body. But one thing they found is a lot of people with Bell's palsy will have that virus present in their body. They're a carrier of that virus. The thought is that when you come under a lot of stress, that can actually activate that herpes simplex 1 virus from a dormant state. So when that virus activates, that'll cause inflammation on that facial nerve, that cranial nerve 7, thus inducing Bell's palsy. To answer the third question is, how can chiropractic seem to help with Bell's palsy? Well, here's my explanation for that. It's well known as chiropractors, we work with the spine. Inside the spine is the spinal cord, and attached to the spinal cord is the brain. When you find that there's some dysfunction up in the neck, some joint dysfunction, which we often call subluxation, it's often associated with, it affects the nerves, and it also causes muscle tension. So when you adjust the upper neck, it does several things. It improves joint function, it can improve nerve performance, and it can reduce inflammation. And so by doing those three things, you can essentially potentially alleviate some of that inflammation and pressure off that facial nerve, and that's where you see improvement in Bell's palsy symptoms. Thanks again to the patient that requested that topic for a video blog. It's very interesting. You viewers continue to email me questions. I'd be glad to answer them in a video blog. So thanks for tuning in today. Have a great weekend. Happy Easter. Thank you.